This lecture, I will discuss about the temporomandibular joint. It is the joint that is between the temporal bone and the mandible and also represent as TMJ. We will discuss the label first. There are 8 labels. First, you can see this is the joint capsule. This is the joint capsule. Second is the ligament, that is the lateral temporomandibular ligament. This is the ligament present on the lateral side, that is the lateral temporomandibular ligament. The third label is the sphenomandibular ligament. The third label is the sphenomandibular ligament. The fourth one is also a ligament, that is the stylomandibular ligament. Fifth, you can see, is the fossa, that is the mandibular fossa. The sixth is the articular disc. Seventh, we have articular tubercle. And the eighth label, that is the capsule, that is the joint capsule. Let's revise them. First, we have a joint capsule. Second is the lateral temporomandibular ligament. Third is the sphenomandibular ligament. Fourth, we have a ligament, stylomandibular ligament. Fifth, we have a fossa, mandibular fossa. It is present on the mandible. Sixth, we have a articular disc. Seventh, we have a articular tubercle. And the eighth, we have a joint capsule. Now we will discuss some important points regarding this. First, temporomandibular joint is the synovial joint. Remember this, it is the synovial joint between the mandibular fossa and the articular tubercle of the temporal bone and head of the mandible. It is the joint between temporal bone and mandible. The joint's two synovial cavities are separated by an articular disc of fibrocartilage, that I discussed this in labels. The unique joint combines an upper uniaxial gliding joint or forward gliding and backward gliding, because temporomandibular joint has a role in protrusion and retraction. It means it moves forward and backward and some side to side motion with a low uniaxial hinge joint below the articular disc for closing and opening of the jaw. These are the functions of a temporomandibular joint. It is the synovial joint. It has a multi-axial. Okay, this joint contain an articular capsule and is reinforced by the lateral and sphenomandibular ligament that I will discuss, that I was discussed in the labels. And the last, very important, we have clinical. TMJ or temporomandibular joint has both a hinge action and gliding or sliding action. Okay, TMJ problems affect about 25% of the population and can result from trauma, any kind of arthritis, infection, clenching or grinding of the teeth. We can call it bruxism or displacement of the articular disc. These are the conditions associated with the abnormal conditions associated with the TMJ. And remember, these TMJ are most common in the TMJ problems are most common in the women than men. In this lecture, I discuss the temporomandibular joint, its labels, what type of joint it is, and its clinical. Thank you.